All right, we're going to get started in just a minute. We're letting our attendees flow in here. Once we give just a minute for everyone to get connected through, we will be ready to get started. All right. Let's go ahead and start. Good morning. Thank you so much for joining us today to talk about caregiving in the LGBTQ plus community. Whoops, that's one too far. My name is Kristen Maki. My pronouns are she and her, and I am the Community Relations and Outreach Program Manager for Walk Here's Fund. I am very pleased to have a fantastic panel joining me today to talk about their experience and work in this area. And we're going to get started with some brief introductions and why we're here. And then each of our panelists will have some time to give an overview of what they do. We'll also have a brief overview of Walk Cares Fund, which is Washington State's new universal long-term care insurance program, and how it will help address some of the issues that we're talking about. Then we will open up for discussion and audience Q&A. So for those of you who joined on a computer, you can go ahead and submit a question for our panel through the Q&A function. Feel free to start getting your questions in at any time, and then we will go through and answer when we reach the discussion section of the presentation. So for right now, we'll start by calling on each panel member to share their basic information. Hannah, let's get started with you.
Hi, my name's Hannah Dahlke. My pronouns are she, her. I'm a member of the LGBTQ plus seniors of the Inland Northwest. We started about 4 years ago when there was a need in our area for a community group for seniors of the community. So since then, we've meet multiple times a month. Since the pandemic, we do mostly over Zoom. We one time a month have a member from the community that is like Spokane AIDS Network or different groups to come explain what they do for seniors, specifically in the LGBTQ plus area, and try to provide support and outreach to each other.
Fantastic. All right, Janice, we'll have you go next.
Hi, I'm Janice Emery. I am a member of the Northwest LGBT Senior Care Provider Network. We have been around 15 years. This is our 15-year anniversary. We are a group of caregivers, anyone in the industry, in the senior industry, evolved around the LGBT community. We have attorneys, advocates, hospice, caregivers, anything related with the senior industry. And we have educate the communities and caregivers on how to work with the seniors in the community, in the LGBT community. We meet once a month now via Zoom. The members have to, it's $100 to join. You have to sign a non-discrimination form and you must attend 4 meetings a year. So you're just not, say that you're a member and you're not actively involved in it.
All right, fantastic. Ruben, let's have you go next.
Good morning, everyone. My name is Ruben Rivera-Jackman. I identify as a Nuyorican gay cisgender man of color. In the daytime, I currently work as a drug court coordinator for the Snohomish County Superior Court here in Everett. But I'm also on the board of Generations Aging with Pride and was one of the founding advisory members. I've been involved with Generations Aging with Pride for about 8 years. And I'm also a national trainer with the LGBT Resource Center on Aging.
All right, thank you, Ruben. Stephen, let's have you go.
Hi there. So my name is Stephen Knipp, and I go by he, him pronouns. I'm the executive director of GenPride, which is the short version for Generations Aging with Pride. So Ruben and I are connected. He is a board member, myself as staff. And we have an organization that supports LGBTQ seniors.
All right, thank you, Stephen. We are going to go ahead and start with a quick audience poll. Let me just get that launched here. We are just asking folks 2 quick questions to help us understand who's in our audience today. So we're asking, what is your experience with long-term care and how much you know about aging and the LGBTQ plus community? If those of you who've joined through Zoom can take a quick moment to answer, we would appreciate it. I will give you just a minute to fill out your answers. We're going to go ahead and do a quick overview of why we're here. So we are, I want to note, using LGBTQ plus here, talking about the community as a whole, but I do want to acknowledge that different groups within the community have different experiences and different needs and can face really different barriers to getting care or support. But when we look at the broad community, we see that LGBTQ plus people make up a significant number of our aging population, about 2.7 million, and that number is going to double by 2030 as our population ages. Also, this group makes up a significant proportion of caregivers and is more likely to take on a caregiving role than non-LGBTQ plus peers. It's important to know that when older adults in our society need care, they almost always turn to family members first, a child, a spouse, or another relative. But this population as a whole is 4 times less likely to have children and 2 times as likely to be single. The good news is that our community has a long history of creating families of choice. And we see that in the 21% of older LGBTQ plus people who have provided care to a friend, compared to only 6% of non-LGBTQ plus older adults. And those caregiving responsibilities, that role can be really rewarding, giving back to and supporting people that we love, but it can also be challenging and stressful. It's also both for caregiving and as older adults, important to note that research has shown LGBTQ plus people have higher rates of poor physical health and of mental distress, due mostly to ongoing experiences of discrimination and other barriers to getting appropriate care. In fact, more than 80% of LGBTQ plus adults in Washington have experienced discrimination in their lifetimes, and more than half have experienced it in the past year. And older LGBTQ plus people often worry about hiding their identity in order to access senior housing or other services that they need. So altogether, it is clear that this population has some unique needs and challenges that are really critical for us to address. I'm going to go ahead and end the poll and share the results. So it looks like we've got a lot of folks who work in long-term care, as well as a smaller but significant proportion of people who are don't maybe have direct experience with caregiving, but are interested in this topic. And then we've got a lot of folks who know a little bit or don't know much about this population in particular. So thank you all for filling that out. That's helpful for our panelists to know as we go into their remarks. So we are going to get started with remarks from Stephen. You are up first.
Great, thank you, Kristen. So just a couple of things I'd like to dive a little bit into history of GenPride. But one thing that's really caught my attention on your slide just a minute ago, Kristen, is this number of people that feel as though they have to go back in the closet to get senior services. And I would say that while GenPride is working on a lot of different areas in this community around senior aging, this is probably one of the most important pieces that we work on in terms of making sure that our seniors are treated with respect, and that they, and also the centers that want to welcome LGBTQ seniors, they know how to make their facilities more welcoming and inclusive. I happen to know Ruben does a lot of work in that area around training different providers. GenPride is also works with both healthcare providers, housing facilities, and senior centers around King County, because even though GenPride is forming our own senior center on Capitol Hill, seniors live everywhere. And so we want to make sure that folks have choices to get senior care in a neighborhood that's closer to their home, and that they feel comfortable going there. One of the original studies that was done by the University of Washington several years ago showed that there was just a lot of people that weren't getting just standard access to senior care services because they weren't going into these senior centers, which are typically heterosexual, but they're typically the biggest place to get access to these resources, and people weren't getting those. So one of our jobs is to really work on making sure these senior centers, which are kind of federally funded programs around the country, that they are welcoming to our population as well. GenPride was founded based on a survey I mentioned a few minutes ago that was done by the University of Washington back in 2016, which showed a lot of the percentages that you had in your opening remarks, Kristen, about just the fact that this community is not getting the same kind of access to resources and having the same kind of experience of aging as our counterparts in the community. So GenPride was formed to not only address this issue around training and getting people more connected to providers and providers that are welcoming, but we also decided to create our own senior center. So GenPride is actually a full-fledged senior center, and in this world of senior center, that is recreational activities, access to social services like food stamps and Medicare and those kinds of things, but also educational workshops, fitness programs, those kinds of things that are kind of about a more well-rounded access to healthcare and just social services with seniors. So we are in the process of building that senior center. We have partnered with Community Roots Housing. This has been a project we've been working on for the last couple of years. Last year, Community Roots Housing and GenPride formed a partnership, and we've broke ground on a building on Capitol Hill, and it's a income qualifying affordable housing for seniors with an emphasis on the LGBTQ community. There'll be 118 apartments there right on Capitol Hill on Broadway, and GenPride will have a 4,400 square foot ground floor service center, providing services not only to the community in the building, but also King County in general. And in that center, we will have not only administrative and volunteer offices, but we'll also have a large community gathering space that will have a commercial kitchen attached to it for meals and different kinds of multicultural events, and then also space for the yoga classes and different kinds of fitness classes that we have, and just general meeting space for the community. There'll also be a health services center at the facility that will provide some basic access to care for folks who are looking for LGBTQ providers or friendly providers. So this project is scheduled to go into operation in August of next year. So about a year from now, GenPride will be moving in along with 118 or more seniors in the LGBTQ community that will be focused here at this building, which is called Pride Place on Broadway. So that's a little overview of GenPride and what we're doing. We have 8 staff that work with me on the project, and we're all busy every day. So there's a lot of work to be done.
Fantastic. Thank you so much, Stephen. All right, Hannah, let's go to you next.
As I said earlier, I'm a member of the senior LGBTQ plus seniors of the Inland Northwest. The group was created 4 years ago by Nancy Avery, who was the Pride team leader at the Unitarian Universalist Church. At first, before COVID, we would meet monthly for lunch out on the town. We would have a potluck and then coffee and conversation also. And it became apparent fairly quickly that as a group, we didn't know much about the services that were available to us as seniors and LGBTQ plus. So in that respect, we started searching. We invited guest speakers once a month to come in and explain what they do for our community, for seniors. And so we've had Aging and Long-Term Care of Eastern Washington, the Spokane Neighborhood Assistance Program, different lawyers, the Spectrum Center, Spokane AIDS Network, End of Life Washington, Spokane Pride, Odyssey Youth Movement, to name several. We So once the pandemic hit, we had a month of not doing anything, and then we switched to Zoom. We have Zoom meetings twice a week, Wednesdays and Fridays at 4. And so that we can support each other. We have a time to check in, go around the group. And we have members from Montana, Washington, Idaho, and Oregon as well. So it's not just a little Spokane group. And we have started doing get-togethers, you know, with COVID in mind. So everybody is vaccinated, and we try to meet outside if we can, and we bring our own food instead of having a potluck. But we still get that sense of community, because that was something that universally we could all agree that we were very lonely and isolated, and that needed to change. So we try to provide resources that different people can use when they need it. So that's about it. Thank you.
Fantastic. Thank you, Hannah. All right. I believe that we have Janice next. Go ahead.
Good morning. I'm Janice Emery. I am filling in for Tiffany Kopak, who has been with the Northwest LGBT Senior Care Provider Group for about 10 years. She had emergency today. So our vision statement, we have a lot of crossover with everyone in this group, obviously, but our vision statement is to provide education and support for the LGBT senior community when navigating through the healthcare continuum, while ensuring that dignity and individual choices are respected and honored. Our website is very user-friendly. Tiffany handles the phone calls, and she gets phone calls often from lonely seniors, from caregivers, from businesses, all looking to for our services. And it's not uncommon that Tiffany will just pick up the phone and talk to somebody for 10 minutes, just to be there for them. Our goal is to help educate care providers and healthcare professionals about the needs in the aging LGBTQ plus community. Our network is based on the collaboration between community organizations and businesses to provide advocacy and quality of life care for the community in the Puget Sound area. So we pretty much stay, we do have members in the Tacoma and other areas, but we pretty much stay in the Seattle area. We do have monthly Zoom meetings. We're starting to venture out. We had a Pride meeting on the last Thursday before Pride, and then we actually had a booth at Pride, very interactive. A lot of people came and learned about our group in the Pride Capital Street Fair. Some of the other principles of our coalition is to educate. We provide education through actions by positive role models and contributing members of the community at large. Some of our speakers, we have two education, she hates to be called specialists, but people that are very knowledgeable in Alzheimer's and memory care come speak. We have insurance panels, basically a lot of education. We connect seniors to our resources. Again, that's the phone calls that Tiffany reaches out to. Our members include attorneys, community service, senior centers, educators, financial planners, home care agency, and hospice agencies. And we support, our collaboration, we work with Family of Choice and Support Network to facilitate the ability to actively participate in decision-making. So if the family of origin is not available or interested in working with our the patients, then we work with the Family of Choice. So anyway, So leave it at that.
All right, thank you, Janice. Ruben, we'll go to you next.
Thank you, Kristen. And again, welcome everyone. Until recently, I was involved with the University of Washington GenPride Center, which is housed in the School of Social Work under the Golson Foundation. I came on, joined the team. I was with them for a year, and we were funded by the Centers for Medicaid and Medicare to develop a curriculum to provide culturally competent care. And the audience was for direct care workers working in long-term care, such as assisted living facilities, nursing homes, and adult family homes. And I'm happy to say that the curriculum was completed and implemented, but unfortunately, due to the pandemic, it was difficult to get in-person training in the long-term care facility. So it was mostly done on Zoom. We did create a 1-hour introduction to Safe Home. The name of the training is the Safe Home Training. And we created a 2-hour and 4-hour training module. For more information on that, I would suggest that you contact the University of Washington. The email is the golsoninstitute.org/safehome. So I was instrumental in working with the team on creating that curriculum. I often get asked, Ruben, why do we need specific training for LGBTQ older adults? And my response to that is that we often experience discrimination and social stigma, including institutionalized discrimination from healthcare facilities, long-term care providers, and social service providers. And that creates barriers for us to access medical, long-term care, and social services than our non-LGBT peers. I also wanted to mention, I know that Janice just mentioned the term families of choice, and I just wanted to provide a little bit of information on that because I think it's important. It's important to understand that it is not uncommon for LGBTQ people to cut ties or distance themselves from their biological families in response to being shunned or disowned due to their sexuality and gender identity. I was lucky. I had a loving mother and siblings that were very open and accepting of me when I came out, but not everyone has that same positive experience. My father actually had more of a difficult time because he was a Pentecostal minister, so he was worried about me identifying as a gay man. So this has caused us to build our own families of choice, which are often made out of the circles of friends that we have chosen, and usually same age. And that's important because what I've realized and what I've learned as I'm going through the aging process, I'll be 58 next month in July. And my husband is 64 years old, and we've had many friends that are experiencing situations now because they're going through the aging process, was that one of the mistakes we made was not including younger people in our family of choice and circle of trust. We also call it circle of trust. Because what happens is that you don't realize that if you don't have younger individuals in that family of choice or circle of trust, as you get older, they're also aging with you. And if they're much older than you are, they may not be there or available to provide care for you when you need it. And you might be the last person standing. And that can be very scary for many of us because we know we become more vulnerable and more at risk for abuse if no one is watching, if no one's checking in on us, and if there's no family members or family of choice or circle of friends that are advocating on our behalf. So it's very important for us to keep in mind that we do need to make sure that we have younger folks in our circle of trust and families of choices. So, I think one of the statistics that was given by Kristen in the opening was that LGBTQ older adults are twice as likely to be single and living alone, and 3 to 4 times less likely to have children, which can limit their social support network, right? The individuals that can provide support and care for them when they need long-term care. So keep that in mind. So we also know that facilities need to really think about their policies around family definition to include families of choice and circle of trust, non-biological families, because these are the individuals that most likely we're going to want them to make decisions on our behalf when we're no longer able to. So I would like folks to keep in mind visitation policies and being honoring and respectful of those individuals that we identify as being part of that family of trust and family of choice. There's some also, health disparities that are specific to LGBTQ older adults, and I think we can get into that a little deeper if people have questions. That creates challenging to caring for LGBTQ older adults in these long-term care facilities and in general. So I'll just stop there with that bit of information. I'm sure we'll have some lively discussion.
All right. Thank you, Ruben. I appreciate hearing from all of you about your work and your experiences in this area. Before we open it for discussion, I'd like to share a little information about the Walk Harris Fund and how the program is working to address some of the issues that we've been talking about today. I'm going to go ahead and share my screen again. All right. So let's start by quickly covering a few basics on long-term care. Long-term care is help with activities of daily living, like bathing, eating, dressing, and taking medication. So that can include formal long-term care in a facility like a nursing home or an adult family home, or it can be care in your own home. And a majority of this type of care is informal. It's unpaid care from mostly family members, but sometimes friends or neighbors. Long-term care is also predictable. 70% of us will need it at some point in our lives, and it's expensive. It costs $33,000 a year for 20 hours of home care per week, more expensive for care in facilities. And it's also important to keep in mind that the family caregiving model is also not free. Frequently, family caregivers experience impacts to their work and financial situation, and the average caregiver spends a lot of their own money on caregiving expenses. Long-term care is not medical care, which means it's not covered by health insurance or Medicare, and it's not covered by Medicaid until your savings are exhausted. It's also just bottom line not affordable for most of us. The median income for Washington seniors is about $56,000 per year. But we've got Walk Harris Fund coming online the next few years here, and Walk Harris can help. It is, as I mentioned, a universal long-term care program in Washington state. It's an earned benefit, which means that only those who contribute are eligible. And once you contribute for a certain number of years, you will qualify for benefits. The program is self-funded from worker contributions, and everyone is covered at the same rate regardless of pre-existing condition. That makes a big difference, especially when we think about those stats from the start of the webinar about this population and physical and mental health concerns. The program also reduces the need to raise taxes to pay for Medicaid long-term care costs as our population ages, and overall is just a more efficient and effective way to pay for long-term care by making affordable contributions across our careers. Contributions to the program are going to begin in July 2023, and benefits will become available in 2026. So how the program works is that employees contribute 0.58% of their wages. Those premiums go into a dedicated trust fund that's used only for this program. There are a few different types of people who are not included. Federal employees are not included in the program, and employees of tribes are not automatically included. But folks who are self-employed are able to opt into the program to contribute and qualify for benefits. And then there's certain groups of workers who can apply for an exemption. And that includes workers who live out of state but work in Washington, temporary workers with a non-immigrant visa, spouses of active duty military members, veterans with a service-connected disability rating of 70% or greater. And then there was an exemption as well, for folks who had private long-term care insurance before November 2021. And you can see that for the typical Washington worker, their income would be about $52,000 a year, and their typical contribution would be about $300 a year. And when we talk about affordable contributions across your career, this is kind of what that looks like. So you can see the typical Washington income is just about at the level in green there in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. So keeping contributions affordable is also important when we look at this population, at the LGBTQ plus population specifically. because we know that discrimination can negatively impact opportunities in education and employment, housing stability, and more, which leads to more financial instability and fewer resources available financially. This is a population that is much more likely to be living in poverty. So keeping contributions affordable is definitely important to us. And everyone who is contributing to Walk Cares Fund and working more than 500 hours per year is earning benefits. By, again, contributing for a certain number of years, you will qualify for the $36,500 benefit. And so there's a few different ways that you can qualify. First of all is the early access to the full benefit. And this is for folks who need care either while they're working. Oftentimes that might be someone who has an accident and then suddenly has a long-term care need, or folks who need care at some point very soon after they stop working. And then for lifetime access to the full benefit, that's when you contribute for a total of 10 years without a break of 5 or more consecutive years. And that means that you have access to the benefit amount, can access it at any point in your life to get the benefits that you need for long-term care. And we also have new this year, new from the latest legislative session, is a new pathway for near retirees. So this is intended to cover folks who are near to retirement right now when the program is starting, who are not likely to be able to work that full 10 years to get lifetime access to the full benefit, to ensure that they still get that lifetime access to at least part of the benefit amount. So this is for folks who were born before 1968. And this group earns 10% of the benefit amount for each year worked. So you can see there, I have someone who works for 3 years and contributes to the fund would be able to access 30% of the full benefit amount. And let's talk just a little bit about the benefit. It is flexible. It's really designed to help people age in place in their homes as long as possible. That's what almost all of us want to do. And most of us are able to do it if we have the right supports in place. You can use the benefit, which is $36,500, but that amount will also be adjusted annually for inflation. And you can use that for any combination of services and supports. That could include professional care at home or in a facility, but really the program is structured to support family caregivers. And by family here, we mean anyone that you consider to be a loved one or part of your family. That includes the families of choice that we've been talking about. Could be a friend, neighbor, whoever is part of your support network. And so you can choose someone who would otherwise be caring for you on an unpaid basis to get training and to be paid to provide that care. It is also will have available support and respite care so that those family caregivers are able to take a break and get done the things that they need to. But you can also use the benefit for a wide range of other supports like adaptive equipment and technology, getting meals delivered to your home, transportation, getting a safety evaluation on your home, and installing things like wheelchair ramps or grab bars. And so there's just a really wide range of services that are available for folks who are eligible for the benefit, which means that you have contributed for the amount of years to have access, and then you need help with 3 activities of daily living, which again are things like bathing, dressing, eating, and medication management. So that's our overview of the program. We are going to go ahead and slide into our audience Q&A, and I I'm going to start us off with this question. What are some unique challenges that people in the LGBTQ plus community face during advanced years? I've already mentioned reduced likelihood of having children or spouses. What else, and how can caregivers support seniors through those unique challenges? So I'll just open that up to the panel. You can feel free to speak up. You can raise your hand if you'd like, and we'll go from there.
I'll go ahead and start and share some of the health disparities, which can include the challenges of healthy aging among LGBTQ older adults. It's important to be aware that there are higher rates of homelessness among the LGBTQ population, as well as higher rates of STDs or STIs, sexually transmitted infections. In 2015, in this country, 50% of men 50 years of age and older were living with HIV. So HIV is still a concern. And this is mostly because older adults are aging with HIV. They've been living with HIV for a long time, and now they're entering their golden years. So keep in mind that HIV is still an issue, and it's not just for the younger population. Also, because of the way we were socialized and not allowed previously to be out and open prior to, Stonewall in '69, most of our socialization was done in bars. So there's higher incidences of tobacco and substance use in our community. When we're looking, many of us have lived experiences of stigma, discrimination, and mistrust of healthcare systems. So sometimes we're not openly sharing things that are very important with our long-term care providers or caregivers that can complicate medical situations or make them worse, or even lead to premature death or institutionalization. So it's very important to allow folks to share their stories and to discuss why they have this mistrust or distrust of healthcare systems. Many of them have had traumatic experiences with clinicians, negative experiences, especially transgender individuals, due to the insensitivity of how they were treated, or hostile workers, workers refusing to provide services like hygiene care, personal care. So there's recorded incidences of abuse that have occurred nationally around long-term care needs and LGBTQ older adults. Individuals make assumptions about us too that can lead to stereotypes and unconscious bias, which can impact service delivery. So it's very important to be respectful, to ask individuals what their preferred names are and what their pronouns are, and to honor them by using those names and pronouns. Training staff to make sure that staff are culturally competent and feel comfortable in serving this population. And if there are staff members that are not comfortable because of their religious background or because of their culture, it's very important for them to understand that they need to refer to another caregiver because it can cause more harm by providing less quality care or discriminatory care. So it's better for them to say, I don't feel comfortable, and let another individual to provide that care, direct care when needed. So we also have difficulty in openly discussing sexual health related issues with our providers. Only 20% of LGBTQ older adults are out to their primary care physicians. So it's very important to also know that you may assume that a person is LGBTQ, but they may not be out to their providers. And it's very important for us to respect their confidentiality and make sure that we're not outing individuals, that we allow them to disclose their sexual orientation and gender identities, and that we're not violating their privacy or confidentiality by outing them or forcing them to come out, or even threatening to not provide care if they don't come out. So I just wanted to share that information. I'll let other panelists also chime in here.
Hannah, I would be interested in hearing from you as well, specifically on challenges that this population faces in more rural areas. I know we've got you coming from Spokane County with members, it sounds like, from a pretty wide region around.
I specifically personally have been hit with this. I fell in January and fractured my hip. I ended up getting 84 hours of home care through Home and Community Services through DSHS. And trying to find a caregiver on the Carina app was very difficult. Most of the caregivers that were available were not LGBTQ friendly. They can state what they're willing to do, what they're not willing to do, who they're willing to care for. And trying to find one, I had a caregiver quit. She did a week and then quit. So then trying to find someone else out of the probably 125 to 150 providers that I looked at on the Carina website, there were 3 that were LGBTQ friendly and willing to give a shower. Out of those 3, 2 contacted me, and one gal I ended up hiring, and today is her first day, ironically. So just to find the caregiver in the first place was a challenge. But I fortunately am out with my provider and my healthcare team. I've been very upfront about it, which I'm very lucky, because most people, like the gentleman before me said, so many people can't be out to their healthcare team. But I would like to see us be able to somehow have more opportunities for the LGBTQ community to be able to find caregivers easier. I don't know if it's just specific to Eastern Washington as an issue, or if it's statewide. But here it's an issue.
Hannah, thank you for sharing your story with us. I would just want to add that it's important for folks to understand that our homes have always been our sanctuary, the one place where we can feel safe. And that includes both in those that live in rural areas as well as in urban areas. So to have strangers come into our house, or folks who don't feel comfortable providing care, and we can pick up on it very easily because of their body language. You know, we can pick up on the unconscious bias. They might think that we don't pick up on it, but we do. Really can affect our experience with that care provider. And there's fear of these folks coming into our home and disrespecting us in our own homes, or not providing substandard care because of their beliefs. So I appreciate you sharing that story, Hannah.
Thank you.
Hi, can I chime in?
Yes, please.
Okay, yeah.
Go for it.
So I think that's where our organization fits in really well, because although I'm going to take back what I said, that we are Seattle based, we do have home healthcare agencies that may be based here, but they are in different counties in the area. So I think reaching out to the LGBT Senior Care Provider Network.com .org's website, excuse me, you could find caregivers that are 100% vested in the LGBTQ community and would be more than happy to come out to assist you.
Thank you.
Welcome.
Yeah, and I'll just add also that, because of this kind of dearth of LGBTQ friendly care providers that Hannah referred to, we're trying to kind of create some support systems for people who are already caregiving for their spouses. We have a lot of people in our organization that they're caring for a spouse at home. They're pretty exhausted. They're wiped out. They don't know how to really do a lot of self-care. So one of the things that GenPride does is twice a year, we do a Powerful Tools for Caregivers, which is a course work with a facilitated social worker, where you really kind of look at your situation and try to find places where you can either do some self-care, get some respite. I think it's really important though to have these folks that are, you know, our kind of extended family doing the work, that they're also really supported by the community. So I'm really glad to see that there's those kinds of training programs out there that are keeping folks in good care with folks that they know. So it's an important piece of that.
All right. We'll do a little sidebar. We've got some questions about walk cares that I'll answer real quick. So we've got a question about whether the program will expand to include those who are already retired. And that's something that is up to the legislature. So right now, we are just getting started in 2023 with folks who begin contributing then and become qualified for benefits by 2026 and after, of course. We've also got some questions about the benefit amount and what it can cover. And so when we talk about the cost of in-home care, which, you know, again, the program is really designed to help you age in place in your home, pay a family caregiver, pay a professional caregiver to come take care of you at your home. The benefit amount can pay for about 20 hours of care per week for a full year. And that is the average amount of care that a Medicaid long-term care in-home long-term care consumer uses right now. So that benefit amount, it's not going to cover 100% of care for everyone, depending on the setting, depending on how you want to use the benefit. But it's a meaningful benefit paid for by a contribution that is hopefully affordable for folks at that, you know, 0.5% of their wages. And, you know, when we look at that 1 year, according to AARP, about 48% of people only need care for a year or less. And for folks who need care for longer, it gives people time to figure out how they will pay for the services that they need. Oftentimes, even if you have private long-term care insurance, there's a waiting period to be able to use those benefits, and walk cares can help in that interim because our benefits will be available as soon as we confirm that you meet those contribution requirements and that you need help with those 3 activities of daily living. We also had a question about whether whether benefits will be paid as a reimbursement of services that are used. And so for that, we will contract with providers and pay them. You will be able to select from providers we have available based on what services and supports you would like that would be helpful for you. Let's see. We've got a couple of folks who are asking to repeat some of the web addresses. Maybe Janice, we can have you repeat that again, but I will mention that we're going to have some information materials from the presentation, and we'll have some of these links available on our website after the webinar as well. So Janice, maybe you can repeat your URL for folks.
Yeah, it's www.nwlgbtseniorcare.org.
Are there any resources, panelists, that you would point folks to that we haven't talked about yet in terms of either where providers can find more information or where older LGBTQ folks can find resources in addition to, you know, looking at any of your organizations for support?
Well, right now, I mentioned that Caregivers, Powerful Tools for Caregivers. It's a program that starts up in August. You can find information on our website. And you can also access a lot of our other services. Right now, all of our programs are virtual until we kind of get past this COVID business here. So we're trying to create a way for folks to kind of get access to things. You can see all that stuff on our website as well. There's also a GenPride Seattle .org/Pride Place will give you all the information about the status of the building, kind of how you would get information about applying once that time comes online. But you can find all that stuff on the GenPrideSeattle.org website.
We've also got a question about, is there anyone who's working to create a network of volunteers who need levels of services below what WACARES provides, primarily for issues of isolation. I think we've kind of touched on that a little bit. I think organizations obviously like GenPride or like Hannah's organization are certainly good resources, but is there anything else that folks would want to highlight there?
On the website, they have a group. There's a list of community events. One's called Momentia. There's an Old Friends Club, which is in Bellevue, Alzheimer's Cafe, and so lots of different. The Seattle Parks and Rec has a Rainbow Recreation, and so that a lot of good resources on our website as well.
Fantastic. Okay. I think we've kind of touched on this a little bit, but Ruben, I would love to hear from you or from the others as well on, is there a most important thing that you think long-term care workers or facilities should be keeping in mind when it comes to this population? I know, Ruben, you had talked a little bit about families of choice. Are there other efforts that you think are important to keep in mind?
Yeah, thank you for that opportunity. Yeah, I think one, so several of the things that we talk about in our training for long-term care providers is the importance of making sure that you're asking SOGI questions of all your residents or all the clients and patients that you're serving. So SOGI is sexual orientation and gender identity. Because it's important to know how your residents or clients and patients identify, so then that you can consider that when you're completing their care plan, right? So it's very important because there's specific health issues and concerns based on sexual orientation and gender identity. I think the other thing would be beneficial, and I think it might be related to the previous question, is doing a better job advertising and marketing to LGBTQ older adults by using affirmative and inclusive language and photos in your brochures and marketing materials, using, making sure that you have affirming and LGBTQ symbols in your comment and share spaces, like posters, rainbow flags, things that alert us that you are an LGBTQ friendly place. Bringing in partners from the community to help you as consultants. So bringing in Stephen and GenPride and Northwest LGBT Senior Providers Network, which I'm also a member of. So bringing us in to consult with us around how you can make your space more welcoming to LGBTQ older adults, maybe training the staff, maybe having a dialogue or conversations with the residents that live there to make sure that they understand the laws of Washington State around discrimination and anti-harassment, and we can deal with bullying issues that might also be issues in those facilities. So, celebrating Pride and other events of LGBTQ culture, promoting those events, providing transportation to Pride events or other events in the community, so that, if you have a lending library or you have a public common library, making sure that there are books and magazines that reflect our community and are of interest in our community. So those are all ways that we can, wearing a pin, for instance, at work, I wear this Proud Ally badge, which is our new rainbow flag. And it says I'm a proud ally. So you can wear a rainbow pin or something that lets people know that you are an ally or someone that they can feel safe speaking to. Again, language is very important. So making sure you're utilizing the pronouns that the folks are asking that you use. My name is Ruben, but if I want you to call me Rosa, I would prefer, and I say, please call me Rosa. I identify as Rosa, that you would be respectful and use that name if that's what I'm asking you to use. So websites, right? Any marketing material, social media, making sure that there are same-sex couples, single couples, couples of same sex, transgender couples, so that you're reflecting the community as a whole. And there's a niche for that because, as Kristen mentioned, 70%, 7 out of 10 of us are going to need long-term care. And from that number of the population, we're thinking it's going to be 7 to 10% who will identify as LGBTQ, who are going to need long-term care. So this is an opportunity for long-term care providers to create these welcoming spaces and safe spaces, and to market to LGBTQ older adults. We're going to be a large part of that consumer that's going to need these services. So if you prepared your agencies, and it's all word of mouth, right? If I have a great experience or positive experience, I'm going to share that with my friends and my inner circle. There's an opportunity for you to provide services for our community, and for our communities to reach out to these organizations that are demonstrating that they're taking LGBTQ older aging individuals serious, and that they're making an effort to train their staff and to create these safe, welcoming environments.
Just to add on to that real quick, one of our members has about 13 different retirement communities. And I stress the word communities because they're no longer facilities, they're people's homes and they're called communities. Anyway, one of the women that moved into one of these communities saw our sticker, the LGBT senior care sticker on the door, and that kind of cinched the deal, and she ended up moving into that community because of that sticker. So I totally agree with Ruben on the social media and having the brochures and documentation.
Janice, thank you for bringing that up. One of the things that the Safe Home training is incorporated in the training is that same idea of providing the agency, once they're trained, with a door decal or window decal that says the staff here have been trained, so that it alerts with the rainbow flag, and I think a safe house. They put a house and a rainbow flag as part of the decal. And we kind of got that idea for the Northwest LGBT Senior Providers Network, just so that people can have a visual sign when they come to the facility that lets them know that the staff there has been trained.
That is fantastic. Thank you. Is there anything else? We're getting pretty close to the end of our time here today. Are there any closing comments that any of the panelists would like to make? Any other information you'd want to share or touch on before we close out?
Well, I would just say thank you, Kristen, for putting this together and for providing this opportunity for us to share our experiences and provide this information to the participants today. And thank you, participants, for taking time out of your busy and chaotic schedule and joining us today for this webinar. We really appreciate it.
Thank you all so much.
Absolutely. All right. Thank you all again for coming. For anybody who is interested in learning more, we will have a recording of the webinar and links to resources from all of our panelists' organizations on the WACARES website at wacaresfund.wa.gov/learn-more. We also have some contact information up here if you'd like to reach out to the program for any more information. We would love to have you join us again. We're going to continue having these webinars. In July, we'll be having a conversation about the gender gap in caregiving. So if you're interested in that, please do visit our website, sign up for our updates, and we'll be sending out more information about that as soon as it's available. Again, thank you all so much for joining us. We really appreciate your time, and we will see you next month.
Thank you, everyone. Be safe.
Thank you. Y'all too.
Take care.